Hey everyone, and welcome back to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, backed by popular demand is a plant-based cardiologist named Dr. Andrew Freeman, and he's going to talk a little bit about what he's been up to since his last appearance on Chef AJ Live and answer the questions you've sent in. Guys, we have so many medical doctors on this show. I believe 20 a month have regular slots, and we can't take questions from the chat usually because we got to give deference and preference to the people that have sent them in. So just respond to the email that we send you on Sunday and say who it's for, and you'll get to the top of the queue. Not getting that email? Well, you better subscribe at chefaj.com. Please welcome back all the way from Colorado, Dr. Andrew Freeman. So nice to see you again.
Yes, thank you so much for having me. I'm here from a beautiful Colorado day, although it is actually snowing here today. So this is a few months old.
I don't know how you deal with weather because I moved from the desert where it never rained, it never snowed. It was like one season to Northern California. It's cold and rainy all the time. How do you adjust to weather? I'm asking you as a person, but also as a doctor. I mean, weather does make a difference on how we feel, our mood. I broke my knee about 10 years ago, and I don't really have a problem with it. But now it's like hurting all the time. It's like almost like I can predict the rain.
Yeah, well, so first, I'm certainly not a weather scientist, but I would tell you that I think it would be foolish for us to deny that there's not some sort of global climate change going on, right? I don't think any of us remember weather quite like this decades ago. So I guess what I would say is, first, I always tell my patients that your body doesn't care if it's a snowstorm, a sandstorm, it's too hot, it's too cold, it's too windy. 30 minutes a day of regular exercise, of course, plus an amazing diet are really great ways to keep yourself healthy. And then I would also say that a lot of people don't realize that just by what we eat, we are sort of voting against climate change, if that makes sense. So if you eat a predominantly plant-based diet, the resources and the environmental impact is quite a bit less. And I think we need to all, as global citizens, shift our behaviors if we would like to live on our planet. And although I wasn't planning on really talking about this, I'm sure you probably are aware, but most of the major medical journals, the New England Journal of Medicine, the Lancet, a number of others all over the world, have made very large commentaries about how our dietary patterns have to change soon, like in the next couple of years, if we aim to have a planet like we remember. So why does that matter to a doctor? And I don't know if a lot of the doctors you have talk about this, but if the temperature goes up, if the climate changes, it allows for more, infectious diseases through, say, mosquitoes, as an example, in places that wouldn't normally have them. Heat exhaustion, extremes in weather cause flooding and personal damage and mold and you name it. So, the planet we live in, the climate we live in actually is an enormous health determinant that a lot of people don't even pay attention to. So bottom line is, I know that we weren't planning on talking about weather, but I think we should all, whether we want to do this for health or for environment or whatever it is, changing lifestyle is a critical thing to keep us all well and be global citizens, so to speak.
Yeah. It's funny because, I don't book my guests based on how popular they are or how many views, but I have noticed, Dr. Freeman, that at least on my channel, and again, this is just a sample of the people that follow me, when we have a medical doctor on that's talking about health, we get the most views and the most engagement, followed by a chef doing the food. But every time I've branched out into the environment and have had experts on that, it's like, or animal rights, those two topics, it's like nobody's interested and nobody watches. Why do you think that is?
Well, it's kind of like this, right? What's the quickest way to not sell an item at a grocery store? Slap a vegan sticker on it, right? And it's unfortunate because the truth is most of the vegan items that you can find taste as good, if not better, than their original versions. But it's funny, like if you ever go to a Whole Foods at the end of the day, the bakery drawer, the bakery cabinet's empty, except for the vegan items. And the truth is, I think you'd be hard pressed to tell that a vegan chocolate chip cookie is any worse than or different than a regular one. So, the question is, why are animal rights not popular? Why is environment not popular? I think people think a lot of it's cliche. There's certainly a lot of controversy in it. But I think there's no debating that our environment is changing. I don't know what that will mean, and I don't think anyone does, but I think there's enough signal in the noise to say, gee, we probably ought to do something. But I also think, like a lot of doctors, if I ask them, hey, did you see the New England Journal commentary or the Lancet commentary on planetary health? almost nobody looked at it. And it's in a top tier journal. So why is that? And I think the answer to the question is people don't know what they don't know. They don't want to, it's hard to hear this, right? Imagine every time you turned on whatever, Chef AJ, it was like one moment someone's baking something awesome that's healthy and actually tastes good. And the next moment, I'm crying that the sky's falling. People don't want to hear it. So I think there's probably a mixture of that, but I think it should be woven into everything we do, right? So again, I wasn't planning on talking about it, but since you asked, I thought people would be interested to know that, us mainstream Western practicing cardiologists are aware that planetary health is really important and completely underestimated. So.
Yeah, thank you. That's so funny. You don't want to sell it, slap a vegan sticker on it. For me, that would make me buy it more, though.
Well, right. When you're there and you already understand why this is important, it's a wonderful thing, right? I mean, I love going to plant-based restaurants, plant-based supermarkets, because everything you buy, you don't have to really worry about. I mean, you could argue some of them are less healthy, but you don't have to worry. I love that. But I would say for the people who are not already enlightened, it is difficult for them to go buy something that is vegan. Like people say to me, oh, well, I got to get you vegan rice. And I'm like, rice is vegan, guys. Where is it? Where would it not be vegan? What are you doing to it? I got to get you apples and make sure they're marked vegan. They're vegan, right? So lots of the good things that people buy don't, my suggestion would be we should do a small experiment, go to a grocery store, find the most beautiful produce you can possibly find, label half of it vegan and half of it not, and see if it makes any difference in sales. It'd be very interesting to see. So.
That is funny. Well, it's funny because you mentioned the difference between a chocolate chip cookie that's vegan and not. I mean, if we're doing like I do, where you're really doing sugar-free and all kinds of restrictions, but regular vegan stuff tastes just like the regular stuff. That's how I was able to be a pastry chef at a regular restaurant. You can't tell any difference. That's the thing. People don't eat a piece of cake and say, well, where's the egg? That the egg was not there for a taste. It was there for a purpose, chemistry function that you can do with a flax egg and things like that. So, but I do think, there's preconceived notions if you label it a certain way. Yeah, absolutely. But that is very, very funny. So, it's funny about doctors because I've been noticing ever since I left LA, because I've lived in two places now, Northern California and the desert. So I had to get new doctors. And in LA, my doctor was vegan and it wasn't a problem. And that's why I sought him out, and it was very easy, the relationship. And I find now that I'm seeing regular doctors, I still see vegan doctors, through Zoom. I always make sure I have one on my team. When I'm sure you have like a charting system in your hospital, it makes it easier now instead of the old fashioned way, and often patients can access it. Like it might say the patient's on this medicine or the patient has this condition. They put vegan as a condition. Do you know what I'm saying? I have asthma. I've had asthma my whole life. And so they're putting it almost like it's a diagnosis, like there's something wrong with me.
Well, I certainly don't do that in my charting. It's funny if you look up, some of the prior terms we use for vitamin B12 deficiency or anemia due to B12 deficiency, it would say things like anemia of the vegan or vegan anemia, because you wouldn't necessarily get B12 through not eating meat or whatever. But yes, I would agree with you. It is certainly not a condition. In fact, I would argue that there are a number of health insurance companies now that are out there that if you are vegan, your rates are lower. So I guess what I would say is I don't consider it a condition, but also remember that it took modern medicine a lot of time to stop labeling things like homosexuality as a disease or pathology state. So I hope that we become more and more smart and progressive as we get, smarter about our nutrition, our lifestyle approaches, that it really doesn't matter. It's not a disease if you don't eat meat.
Yeah, isn't that funny? But it is really, I feel like the doctors they don't understand you. That's why it's so crucial, at least for me, to go to a vegan doctor.
Yes, no, and I think it's important. But I would also say, sadly, there are many places in the country where there are not plant-based doctors. And, don't despair, right? Knowledge is power. And if you ever do get challenged, you can always go to the guidelines. And pretty much every professional society on the planet endorses a plant-based diet for most of the health conditions. So when they tell you, oh, you should eat meat, you should ask them why. Your professional society clearly says it's certainly fine to do this. So knowledge is certainly power. And I always struggle when I hear people say that their doctor told them they had to eat meat.
Oh my gosh. Oh, what a world. Hey, you want to take a few questions from the people?
Yeah, I'd love to. And for those of you that don't know me, I just wanted to quickly introduce myself. So I'm a cardiologist. I work at a place called National Jewish in Denver, Colorado. I take care of all the usual stuff, but I really incorporate lifestyle medicine into everything I do. And I'm the founding co-chair of the American College of Cardiology's Nutrition and Lifestyle Work Group. So before me and my colleagues, there was no such thing, believe it or not. And we've done a lot of great things, published a lot of papers, some really important papers and pivotal papers showing about cardiovascular practitioners' knowledge in the space, which is, as you would guess, limited. And then further, each year I put together a talk about the best science from the last year in plant-based nutrition, plant-based outcomes, et cetera. And so I'm in the process of putting together my 2023 talk, and there's some really great stuff coming. So I hope to come back in a few months and give you that whole talk so you guys can be really impressed at just what's come out in the last year.
Well, I would love it so much. So please, you know how to get in touch with me. So do you agree with the statement made by Dr. Kim Williams, the past president of American College of Cardiology, that there are two kinds of cardiologists, vegan and those who haven't read the data?
So first, the quickest way to offend someone who is a professional is to tell them that they're an idiot, even in a polite way. You could argue that statement pushes on that. That said, Kim is a very close friend of mine. I've known him for a very long time, and he's a mentor to me, and I love what he says. And I think he's accurate in saying that if you are not plant-based or plant-forward or whatever word you want to use, you haven't examined the data carefully. Now, it's not like I'm going to go out there and say to all my colleagues, hey, why aren't you plant-based? But I certainly say that in a more polite way. The truth hurts, right? If you go to a doctor and you're like, well, why aren't you plant-based if all the data suggests this? It puts them on the defensive immediately. So I would say that, interestingly enough, I myself, when I went plant-based probably 11 or 12 years ago, since then, I have created these waves of wellness amongst my peers, right? So I get a patient or 2 or 10 or dozens to go plant-based. They come back to their other doctors that I work with, pulmonologists, rheumatologists, autoimmune specialists, that kind of thing. And, when they come back and their disease is in remission or they're better, the doctor's like, gee, how did you do this? And the patient's like, well, I saw this crazy cardiologist you sent me to, and he wanted me to go plant-based, and I tried it, and I feel the best I've ever felt in my life. Then they reflect on that and they're like, well, maybe I should do that. And so if I had, to guess, my guess is I've had a couple of dozen doctors that are in my network that have made significant changes in their lifestyle with enormously positive results as a result of shared patients. So I think, by and large, knowledge is power, and leading by example is important. And I think when people see that, they make those changes. So it's basically a long-winded answer of saying, I very much agree with what Kim Williams had to say. I'm not sure I would have said it just like that, because it does hurt some people and they get offended. But that said, I think there's a lot of wisdom given there. So
I think it depends on a person's personality, whether they're, if they're more like a Dr. McDougall, Dr. Goldhammer, or,
yes.
But
yeah, and if you've probably talked to Kim, if you haven't, I mean, he's a very soft-spoken, politically savvy, gentle, yet effective leader. And I love what he has done and is doing.
So one of the live viewers is asking, do most of your fellow cardiologists recognize the benefits of a plant-based diet? And I would add whether or not they follow it.
Great question. So, the sort of do as I say kind of doctor is sadly not uncommon, but I don't do it. So as an example, when I was in training in North Philadelphia, an amazing place to train for cardiology, we would have young patients who would have heart attacks or bypass surgery, whatever it was, and then we would say to them things like, you really should eat less cheesesteaks or burgers or greasy Chinese food or whatever it may be. And then we would all go have greasy Chinese food, cheesesteaks, and burgers. So how do you get to the point where you practice what you preach and you tell people to do the same thing you do? I think that's important. That said, as best I know, in all of Colorado, there's only maybe 2 or 3 plant-based cardiologists in practice, believe it or not. Many of them are plant-friendly, meaning they won't turn you away or chastise you if you're plant-based. But by and large, My colleagues are mostly not there. That said, many of them do eat decently well, if not fully plant-based. I would argue they're plant-forward, which is great. Some call themselves Mediterranean, but as you probably know, the American Mediterranean implementation is not really a Mediterranean diet, right? So when people say they're going off for Mediterranean, it almost always implies piles of feta and lamb. But a real Mediterranean diet is really things like lentils and pita and other good vegetables and so forth, as you know well. So I guess what I would say is that's a long-winded way of saying that not everyone's there. People are variably making changes. And I'm pleased to say that I think I've had some impact on people making some of these changes.
That's great. Thank you. All right, let's get to some of the questions that were sent in to us in advance. And there are some in the chat. I'm actually not seeing the chat guide, but I have a wonderful moderator, Susanna, who's texting me the chat. But first we'll go to the ones that are, some days it just doesn't work. And that's why we like them in advance. But these were sent in advance. So Susan says, this is my question for cardiologist, Dr. Andrew Freeman. Is the nuclear stress test dangerous as an alternative to the treadmill stress echo test? I am unable to get my heart rate sufficiently high enough on the treadmill test before my legs get tired.
So let's kind of back up a little bit. So what is the purpose of a stress test? So the purpose of a stress test, it's an indirect way to look for coronary artery disease, meaning is there a blockage in the coronary arteries that supply the heart muscle that's giving symptoms, right? Reduced exercise capacity, shortness of breath, chest pain, angina, some people refer to. And there's a lot of different ways to do a stress test. And the best stress test for you varies a lot on you. So there are standard treadmill stress tests where you just put somebody on a treadmill and slowly but surely crank it up and see how they do and watch their blood pressure, heart rate, and EKG and see how they do. And then to add to that and to add sensitivity and specificity, we can do things like take pictures of the heart. And there's a couple of ways to do that. One is a stress echo, where we take an echo, which is an ultrasound of somebody's heart at rest, and then we put them on the treadmill and make them work real hard and take another echo at peak exercise and make sure that all of the different segments of the heart muscle are moving and contracting well. And then another technique, which is a good one, is a nuclear technique. And that's where we inject a nuclear picture taker, a nuclear tracer into the bloodstream at peak exercise. Or if somebody can't exercise, we use a medicine to replace that exercise. And then we take pictures of it to look at the blood flow in the heart. And we're looking for relative differences in how bright those nuclear photons, if you will, are to decide if an area may have decreased blood flow. So in terms of dangers, the quoted risk for stress testing is something like 1 in 10,000 people might have an issue. Those are highly variable, right? You could fall, you could have a heart attack on the treadmill. I mean, these things are very unlikely, but could occur. The only real issue with a nuclear stress test is that there is radiation, ionizing radiation associated with like a chest X-ray or a CAT scan would have. But by and large, it's a very effective technique. But interestingly, what is emerging and what the guidelines are shifting to and what the science is shifting to is getting actual disease burden through a visualization of the coronary arteries directly. Because all of the tests I just described indirectly tell us if there's a blockage in the heart. You might argue, well, why not just tell me if there's a blockage in the heart and look at the coronaries directly? There's really only two ways to do that. One is an invasive study called an angiogram, or a coronary catheterization with angiogram, where we, put a catheter on someone's wrist and snake it up to their heart and inject dye into the blood vessels, and we can see if there is a blockage. Now, those carry some risks, and it's an invasive study. And then the other way, which is a really great technique, is cardiac CT angiography, which is using a CT scanner to image a moving thing like your heart to look at the coronary arteries and see if there's a blockage in there. And it takes some special techniques because we have to aim to time the radiation, the picture taking, if you will, for when the heart is the least likely to be moving. And the nice thing about CT angiography is it's minimally invasive, it's readily available, it's becoming more affordable, and it gives you an idea of not only if there's a significant blockage, but also the burden of plaque, if you will, or the sludge that's in the pipes. So I think what's going to happen in the next several years is we're going to shift much more towards functional treatment of disease, meaning we're going to look for the actual disease. And we may still have lots of roles for the indirect measurements to get an idea. If somebody has a questionable blockage, a mild blockage, it's always nice to know, well, was there less of that nuclear uptake in that area? but we're also getting good at some techniques to do that with CAT scans too. So I suspect that the future will be much more.
Where'd you go?
CAT scan
Where'd your
driven.
sound?
What's that?
Can't hear him.
You can't hear me?
Uh-oh.
Can you hear me okay?
Are you frozen?
I'm not frozen, but you're frozen. Are you there? There you are. Can you hear me now?
Yes, the last thing the audience said, thank you so much. It's great to have a moderator like Susanna and Jesse. The last thing I heard you say was the word CAT scan.
I don't know how long I was talking without you hearing me.
You mean you don't memorize every little word you say? I'm sure it's.
So I just think, I guess I'll kind of pick up where I left off, but basically I think the future is in actual imaging the coronaries directly using cardiac CT angiography. And the beauty of that test is not only can it show a blockage, but it can also show the burden of plaque or sludge in the pipes, disease. And the future will likely depend on how much sludge, how advanced the disease is, affecting the aggressiveness of our treatment, if that makes sense. So bottom line is, stress tests are great. Nuclear stress tests are great. The risks are low, but they're not zero. You know, if you have had multiple cancers or breast cancer, as an example, I'm assuming it's a woman that's asking the question. You know, the breast tissue is most anterior. So when we give the nuclear picture taker taken up into the heart, you know, the radiation comes through. You know, you could argue that there might be a slightly higher risk for breast cancer as an example, but by and large, it's relatively low radiation and pretty safe.
Great, thanks. All right, this is from Steph. Please ask Dr. Freeman if MCT oil can increase blood cholesterol. The supplement that I take has to be dissolved in oil. That is the only oil I ingest. If MCT oil increases cholesterol, will olive oil or avocado oil be a better alternative?
Yeah, so I'm not sure what supplement they're taking. There are some vitamins that are fat soluble that require an oil. I'm not aware of any that requires MCT oil. And as you may know, MCT typically comes from coconuts. And so coconut oil in general is very high saturated fats, which is artery clogging. So that said, I don't really recommend that you consume large quantities of any of coconut oil. Coconut oil is excellent topically and should really be limited in the diet. It is truly tasty and decadent, but there probably are better ways to go. So first, I'd be curious to see what supplement they're taking, why they're taking it, and if there's a way to get it without a supplement, that's probably better. But if you do need to take some, you know, the question is any oil okay? Well, most of these vitamins have literally just a drop of oil. So you could argue it's a negligible amount. If you look at the data on oil, there's a lot of controversy, particularly in the plant-based world about oil. You know, some would argue based on some bench-based research that oil interferes with endothelial cell function, which is the cells that line the coronary arteries and other blood vessels. But there is some evidence suggesting that, you know, olive oil, canola oil, safflower, sunflower oil might actually be beneficial for cardiovascular health. And I guess what I would tell you is that oil in itself, to me, is a little bit of an abstract concept, right? With rare exception, right? Olives, you can take an olive and just squeeze it and oil comes out. But everything else requires enormous pressure and heat to get the oil out, right? So if you're trying to get oil out of a canola seed, I mean, there are these little teeny tiny things and you're trying to squish them down to nothing. The question becomes, you know, when you extract that out of the matrix it's in, is it still healthy? And I suspect that it probably isn't as healthy as we think. So I tell people to limit oil overall. And if you're going to have to take a supplement, I would probably avoid the coconut oil based ones if you can. Just my 2 cents. But I think that coconut oil makes me nervous in its effects.
Great, thanks. Here is a question from Sherry. I want to know if I am following a plant-based lifestyle, will it stop my burning feet? I had a blood test. I'm not diabetic and my B12 is good.
Well, I guess it would be important to figure out why your feet are burning. What you typically would hear described would be a neuropathy, but some people have burning feet for a variety of other issues. If you've had prior injuries there, you could have something like reflex sympathetic dystrophy. You could have a thyroid abnormality. You could have gout, as an example, which may make your toes burn. But I guess what I would say is if it's a neuropathy, which is what I think you're describing, there is evidence that a plant-based diet can help to reduce or even reverse that condition. But I would say that it probably wouldn't be a bad idea if you sort of have diffuse burning in your legs, that you probably ought to get checked by both a cardiologist and then a nerve specialist neurologist so that they can figure out why you have neuropathies. Because there are other conditions. As an example, where I work at National Jewish, we take care of things like sarcoidosis, which is an inflammatory disorder, which can cause all sorts of small fiber neuropathies and other things like that that need specialized treatment. So bottom line is figure out what you have, but I would suspect that a plant-based diet would help for sure.
Great, thanks. This is from Carrie. Can a whole food plant-based diet and exercise reverse cardiomyopathy, diastolic dysfunction, and large amounts of PVCs? Are there any foods that should be especially considered helpful or to avoid?
Well, so those are all sort of a little bit loaded topics, right? So cardiomyopathy means typically that there's a problem with the muscle in the heart. And cardiomyopathy as a term can imply so many different isolated diseases. Some are genetic, some are acquired, some are viral, as an example. And then PVCs, premature ventricular contractions, or when the heart skips, are often associated with weaker hearts. So the question is, if your heart becomes stronger, if it's weak, will the PVCs be less? The answer is yes, in most cases. But I would say that there is some evidence that following not just a low-fat, whole food, plant-based diet, but boosting exercise, working on stress, ensuring good connections, sleeping enough, having sleep apnea treated as an example, all these things together can actually help to markedly improve heart function. It's something that I love to do. I'm very aggressive with the best of Western medicine, the best of lifestyle medicine, and I've seen enormous recovery in people's heart function all the way up to normal. Now, it is certainly possible to live a normal life with a reduced ejection fraction, meaning your heart is weak. But actuarially speaking, the better your heart function, the more normal your heart function, the more likely you are to live longer. And obviously, the more reserve you have to do things you might want to do. So I guess bottom line is, there's a lot that lifestyle can do to improve things, but I would not discount Western medicine, which has gotten very good at recovering the cardiomyopathy. I'd also point out, and I know that you probably have spoken at length with McDougall and others, who are very anti-stent and anti-cardiologist and all that, but if you've had significant damage done and your heart muscle is weak as a result of that, if you fix some of the blockages, it's possible the heart muscle might recover. So what a lot of people don't realize is that, the more common causes for a weak heart or a cardiomyopathy are ischemia, meaning coronary disease. And when the coronaries start to get blocked up, sometimes the heart muscle, parts of it can die, and sometimes parts of it can hibernate, believe it or not. They literally are sleeping, and they're not moving much, but they're not dead. And if you restore blood supply, they recover. Now, you can certainly restore blood supply through a good lifestyle, but sometimes you still need a stent, especially if some damage has been done in that particular situation. So again, I'm not a fan of throwing stents and medicines at people unless they're needed, but I would say that the best of Western medicine combined with the best of lifestyle medicine is really where you're going to see an enormous improvement. And AJ, there was one other thing that you asked about. It was cardiomyopathy, PVCs, and what was the other one? Diastolic dysfunction?
Yes.
So diastolic dysfunction, which is now more commonly referred to as HFpEF, heart failure with preserved ejection fraction, is when the heart muscle becomes stiff. So a lot of people think that the heart kind of contracts and then it relaxes like a rubber band, but it actually pumps in reverse, if you will. And so when it has trouble doing that, or it does it more slowly, that's sort of what diastolic dysfunction is, the stiff heart. That almost always gets better with good lifestyle, exercise, treating sleep apnea, sleeping enough, losing weight, eating better, etc., but not always. But the truth is, HFpEF, or heart failure preserved ejection fraction, or diastolic dysfunction, is epidemic amongst older Americans. And the reason is our lifestyles get often worse as we get older. We sit around and watch a lot of TV and eat poorly. We got to really fix that. So bottom line is there's a bunch of different things you've brought up, and I've tried to weave them together the best I can. I hope that did justice.
That's great. Well, Dave and others want to know, do you do telehealth, or does somebody have to live in Colorado to see you?
Yeah, so technically speaking, at least by US law, as the pandemic emergency order has ended, I have to be licensed in every state that I'm going to talk to people in. So if you come out to Colorado, first, we specialize in getting people from out of state. But second is, you could go skiing if you wanted and then do a telehealth visit for an hour with me if you wanted. And as long as you're in the state, doesn't matter. But right now, I can't do telehealth out of state right this minute. But I do have an excellent colleague that I work with. I think, Chef AJ, you've probably talked to her, Monica Agarwal.
Nice. Yes,
from
she's
Florida.
been out many times.
Yep. And she has a wonderful burgeoning telehealth business, and it is absolutely amazing what she's been able to do. So
that's fantastic. Okay, so here's a question from, looks like Shelley. Can a plant-based diet clear a less than 50% blockage in a carotid artery?
It's a great question. There has never been a randomized trial on carotid artery disease and a plant-based diet. So what I usually tell people is that when plaque builds up, when there's sludge that builds up in any blood vessel, many times you can get it to reverse a little, but by and large, by the time we often discover it, it's been calcified, which means it's sort of permanent. So then the goal is to prevent progression of disease. So if you're asymptomatic and you have a 50% blockage, the goal would be to die with that rather than from that. And eating a low-fat, whole food, plant-based diet, exercising, working on stress, not smoking, sleeping enough, connecting with others is the best way to prevent progression of disease. And you might argue that you could even benefit from standard Western medicines. Things like statins and other things may reduce your risk as well if you were up for taking those. So long-winded answer of saying that, yes, it is possible. There are some people, if they're early on in the disease, where we can reverse atherosclerosis to some degree. But for many people, we never fully get rid of it, unfortunately, because the damage is sort of done, if you will.
You're very good. Why didn't you take a regular monthly slot?
I don't know. I mean, I have 4 children and a busy practice and life, but I'm happy to do more if I can.
Excuse. No, I'm just kidding. Thank you. But we do have a cardiologist on the lineup. We have Dr. Columbus Batiste.
Oh yeah, so Columbus and I are pals. We've worked together for years at the American College of Cardiology as well. He's one of the first members of our group, and not only does he have that wonderful booming bass voice, but he's an incredibly brilliant and talented cardiologist. So
yeah, so well, good. Well, we welcome you to come back as often as you'd like. Here is an interesting question because there's such controversy about eating whole plant fats. Sharon says, I'm vegan, no oil or processed. I've been so about 3 years. My most recent lipid panel showed my LDL was raised 24 points. I had added back a bit more avocado and nuts and seeds for a good fat source since I'm low weight, BMI 17. My LDL is 100, my HDL is 49, which gives me a ratio of 3 to 4. Total is 169. Should I back off the avocado, nuts, and seeds to bring that back down? By the way, I exercise religiously every day and drink 100 ounces or more of water a day too.
Yeah, so let me get rid of the ratio concept. That's kind of an older concept that nobody really uses anymore. There are a few people perhaps, but by and large, it's probably not the most cutting edge. The other thing I would tell you is depending on how your lipid panel was drawn, where it was drawn, almost always the LDL is calculated as opposed to directly measured. And so there are inherent flaws in estimates in how we do that. Like even standing versus sitting might actually change your lipid panel. So I would argue if your LDL is going up and down by 10, 20 points, it might just be the way it's measured. And you can certainly get a direct LDL if you would like, just ask your doctor to order that. That said, if you don't have any other risk factors, an LDL of 100 is pretty good. You could argue that wouldn't it be nice to get your LDL down to say 30, like when you were born? That would be lovely. For many people with a mixture of genetics, lifestyle, whatever, they can't get that low. I can't get that low despite my best efforts. And so the question is, what about nuts, olive oils, and seeds? Nobody really knows the answer here, right? So, you could experiment and see if one of those will lower your LDL. Different people respond to different plant-based fats differently. You might cut out just the oil and see if the nuts and avocado in small quantities help you. I would tell you that I think that there's emerging evidence that avocados in themselves appear to be helpful. The question is, should you have, 2 dozen a week? And the answer is probably no. So what I would say, what I usually tell my patients is if they want to have avocado and they don't have a weight problem, to limit it to maybe one a week. A little slice does a lot for whatever it is you're trying to eat. So I guess what I would say is, I'm not sure I have a solid answer to tell you exactly what to adjust for you, because everybody seems to respond a little bit differently. And you might experiment. And when you do experiment, ask the doctor to order a direct LDL, which is a directly measured LDL, and use that as your benchmark. And you may find a little bit of a more sort of, and then you can do kind of experiments, right? So here's my LDL when I don't eat avocados. Here's my LDL when I don't eat oil. Here's my LDL when I don't do this. And before long, you'll know. Now, realize your insurance company may not cover all of these tests. They're not very expensive, but I want you to be prepared that if you are checking your cholesterol every 4 weeks, there might be some questions asked. So.
Great, thanks. Speaking of the consultations, if somebody wanted you to review their data from nuclear, NST, echo, CAT scan, EKGs, you can do that, but they have to be in Colorado, right?
Well, I have another way to help with that too. So there's a wonderful service that I recently connected with called Best in Class MD. And the way they work is they allow me to review your records, talk to you about your plan, but it is a strictly non-recommendation consultative service. So basically, it's written in a way where it doesn't count as me providing or delivering medical care, but we can have a conversation like we're doing now. So that would be one way to do it. So you can request me to review your records and see you, if you will, over telehealth without the traditional medical practice type of thing done with Best in Class MD. So check them out. They're really neat. They also offer orthopedic services and all kinds of things for opinions and so forth. But basically, it's a nice way to get a second opinion. So I could do that, but it's not the traditional telehealth visit that's covered by your insurance kind of thing. But yes, if they come to Colorado, I am happy to review records in person or on telehealth or whatever. And if not, Best in Class MD is a pretty neat new service that's exciting because it's not really practicing medicine, but it allows me to review things with people.
Will you send me that link when we're done, and I'll add it to the show notes?
Sure.
Okay, thank you. Here's a question from Deborah. My husband, who is 83 years old and underweight, has ectopic heartbeats, and that at times stops him from functioning well. We are mostly plant-based. Would you recommend metoprolol as prescribed, or what would you advise?
So, the truth is, if I were to put a monitor on every person and look at every heartbeat you've had in a day, let's say you had 100,000, most people would have some quantity of skipped beats, and they're usually pretty benign. But if they're bothering you, or there's a large quantity of them, then something more needs to be done. And one of the first things that can be done is to try a medicine that would slow the likelihood of these skip beats. So that would be a drug like metoprolol as an example, or others. There are beta blockers and calcium channel blockers and a few others that we can use that can actually help to reduce the burden of these PVCs or palpitations that might be experienced. But if someone's having a lot of PVCs, it also is worthwhile to exclude ischemia, coronary disease, as the cause. And so, it'd be worth checking in with the doctor and making sure that they've done that if they haven't.
Great, thank you. You mentioned you have 4 kids. May I ask what their age range is, and do they eat healthfully?
Yes, so they're 4. My oldest is 13, and then we have 11, 8, and 2. And by and large, they eat a predominantly plant-based diet. I'm finding that it's sort of impossible to get dairy completely eliminated from their diet, mostly because of the schools and the stuff that's brought into the schools. It's scary, even in a healthier state like Colorado, how unhealthy some of the foods are that are brought in or served in their cafeteria. But by and large, they eat plant-based, so like as an example, the other night we were coming back from the mountains because they all ski except for the 2-year-old. And we stopped and got a whole spread of plant-based sushi. And I can't tell you how many cucumber rolls were consumed in short order, but they're living well and playing sports and competing and whatnot, eating a plant-based diet. And we eat a lot of vegetables, soybeans, and you name it. I mean, sushi night in our house is always a lot of fun. So.
Are they boys or girls or combination?
My daughter's the oldest. And the rest are boys.
Wow. Well, congratulations. Sounds like you have a great family. And here's a question. Can chronic anxiety cause heart problems? And if so, is there something we can do about it?
So it turns out that stress actually has a huge impact on how we do. I mean, think about this. The medical word we use for high blood pressure is hypertension, right? Too much tension. Even the word disease, dis-ease, right? Lack of ease. So you could argue that a lot of the words we've described diseases with, medicines with, or issues that people have are related to our mental health that are often not even discussed. So I guess what I would say is that anxiety and chronic stress can raise cholesterol, they can raise blood pressure, they can increase the risk for a cardiovascular event. There's even been studies showing that type A personality is actually much more prone to having heart issues occur. You've all seen the movies and TV shows where, the angry boss, the angry whatever, all of a sudden clutches his chest and drops dead. There's really some science behind that, believe it or not. So I guess what I would say is yes. Now, that's not to say that you can live life fully without stress, right? We all know people that somehow, they make cajillions of dollars. They seem to never have to deal with any important life or adult issue and somehow go through life completely easily. I don't know many of those people, but there are a few of them. But I think that in general, life has its positive stresses and negative stresses. And the goal is to spend time every day reflecting on things and casting off things so that they don't eat at you, right? So, if you look behind me, right, the Japanese call it forest bathing, right? Go for a hike, cast off your stress, and see what it does for you. And there's been enormous amounts of data published, even a statement in the last year from the AHA about meditation and mindfulness and how it actually improves outcomes. And then you probably are familiar with the work of John Kabat-Zinn and others over the years that have shown that prayer is surprisingly powerful, even if it's not for your own religion and the own way you practice. I mean, there's so many amazing things out there. So I guess what I would say is you can't have disease without your mind. And if your mind is under stress, do something about it. And it doesn't mean, right, if you just lost your job and you're, financially in trouble, it doesn't mean that you're going to, suddenly think about being rich and be rich, but there is some evidence suggesting that you attract what you think about. So spend some time.
I've been blessed for the last probably 5 years. I've been self-employed, so I have time to exercise every day and eat right and sleep right. But think about, like you mentioned, you have like, how do you have 4 kids, like basically young kids, and being a doctor? I mean, how does the average person have time to make time for adequate sleep, exercise, stress reduction, like meditation, healthy? I mean, it just seems like if you have a regular job, you don't.
Well, the secret, at least for me, has been to weave things in, right? So, first of all, me and my wife are a team. We have an au pair because sometimes we have 3 kids in different places at once, and we need some help getting there. But by and large, we do our best to weave things into our life. So for instance, I'll get up at 5 a.m. or 4:30 in the morning and get 30 minutes of brisk, breathless activity in, walk the dogs, get the kids ready for breakfast or whatever, and then head out for work. And then I try to come home in time for dinner, and I help with bedtime. I bathe my son, my littlest son, almost every night when I can. I mean, unless I'm traveling or something. So we try to make it work. And the key is just to weave it into your everyday life. So if you have a 15 or 20 minute or 30 minute, or if you're in California, you might have a 2-hour commute, you can meditate while you're driving. Now, that doesn't mean you turn on the meditation music that puts you to sleep and you get into a car accident. It means that you are spending time putting your, self on autopilot and thinking about your day, casting off what you do. I mean, one of the things I try to do before I leave work every day, and this is true for a lot of professionals, is you hold yourself accountable for everything that doesn't go wrong. And where I grew up on the East Coast, guilt was just part of life. And so how do you say to yourself, okay, did I do everything I could, but Mr. Jones passed away? Well, did I really go the extra mile for him? And if I answer that question, yes, then I forgive myself for the outcomes that weren't ideal. And I try to leave it at work before I come home. So easier said than done. Am I perfect? Do I screw up? Absolutely. I mean, you find me somebody who doesn't, right? If I get a cold or something, which of course with little kids always happens, I'm probably not getting up at 4:30 in the morning to work out that day. I might take a day off. But by and large, I try to live well and smart. And if I can't put together a, easy lunch, or we have leftovers typically from our dinners, I have a few plant-based burritos I've made in advance that I grab that are low fat and whole food. And that's what I eat, right? It's not the same home cooked meal I'd love, but it's sometimes in a pinch, that's what I have to do. I used to make my own cold brew and brew my own iced tea. And now I drink, I don't know if you guys, whatever, no sugar, just tea, iced tea that I find, right? So you might argue that there are ways to figure out how to be effective in the way you do things and efficient in the way you do things that might not be perfectly the way you want to do, right? I'd much rather brew my own iced tea or cold brew, but now I buy it in a jar or can or whatever it may be. So that kind of thing.
Great, thanks. Do you think you can really die of a broken heart?
So broken heart syndrome, and it actually comes from the original Japanese study. It's actually called Takotsubo. And Takotsubo is Japanese for octopus trap, because the heart actually looks like a sort of ballooned out tip, if you will, which is how an octopus trap looks if you were going to eat octopus, as an example. Anyway, yes, it's a real syndrome. It really occurs. It typically occurs in stressful situations. It often looks like a heart attack.
Well, the reason I asked is my grandparents were married like 66 years. Like they got married when they were 20. And it's like once my grandmother died, it was like my grandfather just died. I mean, do you know what I'm saying? Like,
yeah, well, it's actually not uncommon. I see that a lot, especially in my older patients, where when one goes, the other tends to go. It's kind of like if you watch that movie, The Notebook. And those are, the question is, and this gets into a lot of this stuff that we don't really fully know how to characterize, right? It's the squishy part of science, but I think that people, especially if you've been together that long, they depend on each other, they grow used to each other, they become lonely when one's not around. And so, yes, I think that people die, and they don't always have the physical broken heart, but I think that sometimes they lose the will to live.
I just want my husband to go first. I don't. I pray for that every day. Dr. Freeman, we have like a ton of questions, and I know you're working, so I want to respect your time. So I'll talk to you until you don't want to talk. So you just tell me how many more questions you'd like to take.
Yeah, I mean, I'm good for probably another 10 minutes or so, if that works for you.
Perfect. I'm here all day. So this one is, have you seen personally the reversal of an artery blockage in a person who went from the standard American diet to a plant-based diet?
So I will tell you that I have seen a marked reduction in atherosclerosis. It really depends on what you mean by reversal, right? Are you saying, have I seen a coronary artery go from 99% blocked to 0? No. Have I seen somebody who had moderate coronary disease and then we recath them for one reason or another down the road go to nearly 0? Yes. Is that common? No, at least not in my practice.
Great, thanks. Here's something about dizzy spells, and they're asking what the tilt table test is. There are 3 people that experience anxiety and or dizziness and have been referred to a cardiologist.
Well, so anxiety, I'm going to take off the equation here. So a tilt table study is when literally you'll get a kick out of this, but we typically will strap somebody to a table and change their position to provoke symptoms. Some people drop their blood pressure. Some people increase their heart rate. Some people drop their heart rate. Some people have these very long pauses. I have a young person who on the tilt table, their heartbeat stopped for almost 15 seconds. So many of these people are being tested this way because they have some form of autonomic dysfunction, which means that the things that normally would control heartbeat or blood pressure or whatever, which we don't really think about, are not working well for one reason or another. And a tilt table study helps people figure out why they may be. The most common way that people get into a tilt table study is they typically will pass out. They have an extensive workup that doesn't reveal anything, and then they have recurrent symptoms. And so a tilt table study can sometimes be offered. In the post-COVID era that we're in, there's a lot of people who have developed dysautonomias, meaning that their autonomic nervous system isn't working so well, and a tilt table study is one way to elicit that. In many labs during the tilt table study, they'll not only change position, but give provocative medicines to see if we can trigger arrhythmias or drastic changes in heart rate or blood pressure. So it's useful in some situations. I would argue it might be a little overutilized in some areas in our country.
Great, thank you. Which one? Okay, this one came in early, so I should go to it first. When you switched from just being a regular cardiologist to a plant-based cardiologist, did you see improvements in your patients and in cardiac rehab type things?
So personally speaking, when I did this, I actually redid my life insurance physical, and the numbers were so good that I got a rebate check in the mail, which was pretty amazing. And that was when I was pretty young. That said, we run one of the only intensive cardiac rehab programs in the Denver metro region, which is based on the work of Ornish. That program is impressive as can be. I mean, people are losing weight, blood pressure drops, A1C drops, physical capacity improves, mood improves, depression, anxiety scores all go down. I mean, it's a win in every way. So if you have a friend, colleague, yourself, have been through a cardiovascular event, you probably qualify for intensive cardiac rehab. It's 9 weeks, twice a week for 4 hours at a time, hour of exercise, hour of plant-based nutrition run by an RD with a meal given, an hour of group support, and an hour of stress relief done by a certified yoga instructor. And the results are truly amazing. And I'm not just saying that. So that kind of a result is so rarely seen, but for the people that do this program, it is the most recharging and rewarding experience you can ever see.
Great, thanks. Here is a question on pre-ventricular contractions. Cindy wants to know, are they harmful over time, and how do you prevent them from occurring?
Yeah, so we talked a little bit about this already. PVCs are skipped beats from the bottom of your heart, premature ventricular contractions, ventricle being the bottom of the heart. In general, they're usually benign unless you feel them, you get lightheaded, you pass out, or you have a lot of them, usually defined as more than 20% of the time, which can predispose you to having what's called a tachycardia-induced cardiomyopathy, which is a weakened heart as a result of too many of those skipped beats. So by and large, lots of us have them. You probably have them. Many of us have them. We don't even know we have them. But if you're sensing them, they're bothering you, you're getting lightheaded, you're passing out, or if you have a lot of them, something more should be done.
Great, thanks. Oh, you're going quickly. Da, 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 da. Do you think that lipids can ever be too low?
So great question. We used to worry years ago, especially when those PCSK9 inhibitor drugs, the injectable cholesterol drugs came out, that if someone's LDL was too low, that they'd be at risk for cancer, brain bleeds, all sorts, nerve dysfunction, all sorts of things. The truth is, it doesn't seem to be dangerous, right? There was only one study recently that showed that if LDL got very low, there might be a higher risk for cataracts. That's never been reproven, though. So I guess what I would say is, most of us these days are of the philosophy that there's no LDL that's too low. There's no cholesterol that's too low. And it seems that if we can get the LDL very, very low, the likelihood of coronary disease progression is also very, very low. So, if someone said to me, would you like to have cataracts or a heart attack? I'm choosing cataracts. But I think in general, I don't think that's even a risk anymore. So the answer is usually no. And we haven't, the thought about, cerebral hemorrhage, brain bleeds, nerve dysfunction, most of these have been largely debunked at this point.
Great, thank you. Okay.
And as I mentioned earlier, I should say, when we're born, our LDL is like in the 30s, right? So, the real question is, if we can maintain that throughout our life, would that keep us away from heart disease? And as Esselstyn says, heart disease is a food-borne illness. So,
yeah, need never exist, and if it exists, it need never progress.
There you go.
What are your thoughts on coconut water, advantages or disadvantages? It's kind of high in sugar, isn't it?
Well, it depends, right? So coconut water in itself, you could argue, is sort of nature's Gatorade, right? So you want to stay away from the milk, which is super high in fat, but the water part is very high in a variety of electrolytes. So, that's a more natural way of getting electrolytes in. Some of it may have sugar in it. Some of it has sugar added to it. So I wouldn't drink that if I were you. But in general, you can also get electrolyte powders now that you can add to water that don't have any artificial chemicals, sweeteners, or whatever. That might be a better way. But if you're out and about, if you're in a tropical paradise and you're on a hike and you run out of water, grab a coconut, stick a straw in it, and drink away.
How are you going to do that, though? They're really hard to open, right?
You need like a corkscrew to do it, really, or a drill, but yes, you can do it.
Yeah, absolutely. There was something, there's all these carnitine and taurine. What are your thoughts on these supplements, asks Anne?
Yeah, I usually don't recommend people take them. So carnitine is typically found in meat. We know that the gut flora that consume carnitine can typically turn it into something called transmethylamine oxide, or TMAO, which you may have heard about. It turns out that higher TMAO levels are actually associated with worsened cardiovascular events, heart failure, death, etc. So in general, I don't usually recommend them unless there's some deficiency or you have some genetic issue that would make you need to take it.
Nice. There's a question on soy, but I'm afraid to ask it because I don't know if you know Dr. Peter Rogers. He has a regular slot on this show. And he does about a 2.5 hour PowerPoint when he comes on. And he personally said he would not take soy and flaxseed. And this was like his opinion. He wasn't telling other people what to do. He had looked at like maybe 50 articles, which he sent me, and people were just blasting him because it's like when one, I think about, because you seem like such a reasonable person, like when you mentioned that as much as you like Dr. Kim Williams' comment, that might not be something you would say to people. This may be a question for Dr. Lyle when he comes on, but why are people so mean? Like, I mean, the plant-based world, we agree on more than we don't, but we focus
Totally.
on where we don't. And the thing is, this guy is a credible doctor. And, the people were so mean to him in the chat and on YouTube because he disagreed with another plant-based doctor.
Yeah, so I would say there's this, what I call militant vegan movement out there. And the truth is, if you look at most of what we're all trying to do, we are within spitting distance of each other. There's people who are pro-oil, anti-oil, pro-soy, pro-nuts, blah, blah, blah. If you push Esselstyn hard enough, and I've done that, he'll tell you can have 3 walnut halves in a day, right? So that's not 100% nut-free, but then it's easy to go down a road where you're eating a lot of nuts, and that's a very good point. So I guess what I would say is there's a lot more similarity than there is difference, and we should unite together to change the planet and not attack each other. My take on soy is, first, American soy, I typically try to avoid. I try to get non-GMO organic soy if it's going to be American, or I go to H Mart and buy soy from other parts of the world, which is also plenty good. But I guess what I would say is that the data on soy appears to be healthful, protective, lipid lowering. There's concern about breast cancer and other things like that. And I always tell people, the most potent phytoestrogen that we consume actually comes from things like beer. There's a compound in beer called 8-PN that gets converted into a very strong phytoestrogen. And people are drinking beer like it's going out of style these days. Maybe not in January, since it's the dry January movement, but by and large, it's more potent than soy. So I guess what I would say is, if you look at studies over the years, particularly in Asia, people who consume soy regularly, particularly not the stuff that's sprayed with Roundup like it is here in the United States, they tend to do better. They have less heart disease, etc. If you are sensitive to soy, you're allergic to soy, don't consume it. But if you are not allergic or sensitive to it, try to get organic, non-GMO. The data would suggest that's good. And then more than anything, let's be friends about this. Let's be cordial and civil. Let's treat each other with respect, right? This other doctor, I'm sure, has lots of years of knowledge and data that is conflicting. There's a lot of it out there. And to me, the totality of the evidence suggests that soy is probably healthful. Now, highly processed soy that's turned into sugar cookies or whatever is not what I'm talking about. Eat edamame, have some tofu, right? As long as you're not allergic or sensitive to it. Tofu is an excellent source of calcium, as an example. So there's a lot of ways to look at data, and the goal is to look at it in a reasonable, approachable way. And I always tell the people who are the militant vegans that are attacking each other and social media this and social media that, and they're ripping each other apart. I mean, we're trying to set the example for the world, and we need to be beacons, not, wow, look at those people fight like crazy people. That's not what we need.
I know. It's just, oh boy. Well, thank you. You seem very calm and moderate. You're not a Libra, are you?
Scorpio, actually.
Wow, I never would have guessed. And
Yeah.
That's not very scientific. And I'll probably get a comment just that I even asked that.
I mean, if you look at the data behind it, it means that we're intense and passionate people. And I would agree that I am definitely that.
Well, you're incredible. Last question, because I keep seeing people asking about salt. How much do you recommend? And what about this green salt? It's the rage. What green salt is, it's still sodium, but it's about 75% less sodium because it's from sea asparagus. So it's basically a sea vegetable.
Yeah, I mean, so salt is salt. The goal would be to limit your overall intake, if you can, to about 1,500 milligrams or less a day. You could liberalize that out to 2,000 or even 2,500 if you don't have any heart conditions. There are lots of salt mixtures, including things like green salt and others that are recently on the market that are a lot less sodium. That may be a way to flavor your foods, but I would also tell you that we live in a world where you can get virtually any spice you want delivered tomorrow by whatever favorite delivery service you use. And there are so many delicious spices that most of us never even grew up with that will flavor your foods without any sodium. So in short, switch to less sodium if you can, and we'll go from there.
Great. Well, thank you so much. This has just really been wonderful. And please, you know how to contact me whenever you want to do your presentation, 2023 year in plans, or if you just feel like hopping on because you want to.
Yes. Well, I would love to do that. It's been a pleasure talking with you and your audience as always, and have a lovely new year.
Thank you so much, Dr. Freeman. And thanks all of you for watching another episode of Chef AJ Live. I sure hope you'll come back tomorrow when we have two great shows. At 9 a.m. Pacific time, we have a wonderful plant-based registered dietitian, Kaylee Anderson. And at 11, we have the debut of a new show, Vegan Doc Talk, with a plant-based doctor, Dr. Scott Harrington. Thanks, everyone. Please get those questions into us through the email that we send you every Sunday. And if you like what you see,